Hi, I'm Alana Hippensteel from Pharmacy Times. Before we get started, one of our top articles today discusses how frontline healthcare workers have a threefold increased risk of contracting COVID-19 despite use of PPE. There's more of that on pharmacytimes.com. Today, I'm speaking with Anne-Marie Kondic, the Executive Director of the Community Pharmacy Foundation, on the work that the Community Pharmacy Foundation has been engaged in to promote the value of the practice of the pharmacy in the community pharmacy setting. So Anne-Marie, what is the Community Pharmacy Foundation and what kind of work does it support?
Yeah, thanks, Alana. The Community Pharmacy Foundation is a nonprofit organization dedicated to advancing the practice of pharmacy in the community setting. And we do that through grant funding and resource sharing. And ultimately, the main purpose and the focus of our foundation through these efforts is to improve patient care. So at the end of the day, it's really all about patient care through these efforts that we have with grant funding and resource sharing.
Right. I understand that CPF has partnered with Community Pharmacy Enhanced Services Networks to offer the Flip the Pharmacy initiative. What kind of work has this initiative been focusing on, supporting and promoting?
Yeah, the Flip the Pharmacy initiative kicked off almost a year ago, and the main purpose and focus is to scale pharmacy transformation. So it's really looking at sort of taking our purpose for CPF of funding small innovative grants, but really blowing it up. And it was a natural partnership with the CPESN, or Community Pharmacy Enhanced Services Network, because they had these networks in place. They were a ripe model ready to go. And so that was the nature of the relationship. And it's looking to scale practice transformation across many of these CPESN pharmacies, but it also could be any other pharmacy. And the main intention is changing from focusing on a moment in time, so at the prescription transaction level, to caring for patients over time, and that longitudinal patient care process that requires some change in workflow and some change in the way the pharmacy is managed and patients are cared for. And that's really the purpose of Flip the Pharmacy, and it's meant to be, CPF is committed to a 3-year commitment, and we're looking for a 5-year program.
Yeah.
With the Flip the Pharmacy initiative.
Excellent. How has Flip the Pharmacy been engaged with pharmacist efforts during the COVID-19 pandemic?
Yeah, so the Flip the Pharmacy program is built on 6 domains. Those domains are focused on the appointment-based model, patient follow-up and monitoring, new roles for non-pharmacist support staff, optimizing utilization of technology and care planning, so following patients over time and utilizing technology, working relationships with other care team members, and then ultimately taking all that information and packaging it to show the business model and expressing the value. So those 6 domains are the focus of the transformation efforts in the pharmacies. So that's 6 months. And then for those 6 months, we have implemented different topic areas as a focus. The ultimate goal is the whole patient care, but we've used focus areas such as hypertension, opioid stewardship, diabetes and immunizations is coming up, and then behavioral health and social determinants of health. So if you take those 6 domains and those 4 medication optimization or clinical areas, there's your 2-year cohort for Flip the Pharmacy. So that was all nicely laid out pictorially and ready to go. Well, come March, COVID-19 happened. And the leadership of the transformation effort, so Randy McDonough and Cody Clifton, both involved with CPSN, but also highly involved with the Flip the Pharmacy, realized that in order to address patient care and pharmacy workflow, they had to address COVID-19 factors. So the team pretty much overnight released 4 change packages, and change package is the materials, the way the materials are packaged to share and educate the pharmacies about the processes to transform practice. And so 4 COVID-19 change packages were released, looking at the pharmacy's workflow and how to address the aspects of COVID-19. How do you change care planning for patients when you have to meet them on the corner or out in the car in the middle of the rain? They're not sitting in your clinical consultation area. applying for CLIA waivers so that when it's time and pharmacies are available to vaccinate and test, they've got the proper requirements in place, and then ultimately reopening the pharmacy. And so that was a big focus and push initially. And, interestingly, unfortunately, these resources are still highly relevant today because of the nature of COVID-19 and the where it's surging. So we want to make sure that everyone knows that these resources are available. They're publicly available. Everything with Flip the Pharmacy is publicly available. The nature of Flip the Pharmacy actually, and the funding from CPF comes to fund coaches. And those coaches are the ones that are taking this change package out to the over 500 pharmacies that are in the first cohort. So there's a team, and then there's coaches, and those coaches go into the pharmacy and walk through this content that I talked about, those 6 domains and the 4 topic areas. And what the team realized with the COVID-19 change packages is that there's a lot of pharmacies doing great things already. We don't need to recreate the wheel, but we need to utilize the materials that are successful and working well in the pharmacies. So the COVID-19 brought about the best practices and resources section, and that's how the change packages have actually morphed, even from our first one to the second one, the topic areas. And it's really bringing in examples of pharmacies that are already sort of excelling and utilizing materials in these spaces and repurposing it and sharing it with the others. So now you've got the experts sort of sharing how they've used some tools, and that came about with COVID-19. And so there's a whole COVID-19 best practices, and that's now evolving into the way that the change packages are being developed going forward. So although I think Randy would say, it was sort of the worst thing that happened, it was also ended up being some of the best things that's happened to pivot how the change packages are developed and the materials are utilized.
Yeah.
And that the team is utilizing the experts, the pharmacists that are already in the program. So it was a challenge. I'd say it was a time crunch, but they did a great job releasing it.
Yeah, absolutely. So I understand that the first cohort for Flip the Pharmacy has different teams from each state in the country. Why was it beneficial to group these teams so that they are state specific?
Yeah, so that was a sort of a natural evolution for how the Flip the Pharmacy program was launched. So it focused on those CPESN teams, and those teams are organized at the state level. So for simplicity and ease, and the way that CPESN pharmacies organized as a clinically integrated network, so that affords them some protection as a group of pharmacies and allows them to negotiate with payers and contract because of that structure. That structure was already in place, and for the most part, that's at a state level. So that in turn kind of takes a state and makes it an accountable pharmacy organization, these groups of pharmacies that are working together to improve patient care and contract with payers. So that gave us sort of that state focus. And interestingly, there was an area that had a payer opportunity in the Tennessee, North Carolina, Virginia sort of corner that allowed 4 different teams, so different networks, different CPSN networks, to come together. They formed a team, and their team was predominantly focused in this payer opportunity. So Team GATE, the Greater Appalachia Transformation Effort. So even though it was different teams across different states, they came together because they had an opportunity to perform and deliver the patient outcomes, and that's what they're tracking. So.
Yeah.
And we do have distribution across the country, so east to west, the different geographies as far as urban, suburban, and rural. So it's pretty diverse across those different metrics.
Yeah. So with the second round getting started for Flip the Pharmacy in October of this year, what is CPF interested in seeing in this second round?
Yeah, and so it's perfect timing. This is the top agenda for our upcoming board members, our board meeting, where we're looking at all of the applications that came in for the second cohort of the Flip the Pharmacy team. And so a preliminary review looks like there's existing teams that are adding more pharmacies, and there's new teams that have started CPESN networks that have joined. And those are the funded teams. So those are the teams that CPF is funded, but there's also unfunded teams. So this program is open to anyone that wants to participate to get sort of the benefits and the structure. It requires sharing data. And that doesn't have to be in the form of the networks that CPSN already has, but it isn't meant to be an open program to scale pharmacy and raise everyone up. And then the other aspect is that the materials are publicly available. But what we're really looking for with this is more of the same, but maybe focused on meeting additional metrics. So that first year of starting any program is sort of a learning year. And I think the team has found their way. And like I alluded to some of the changes that we've made. And that is the principle of the program, is to pivot and change as needed to make it the most useful and beneficial. So we're going to be looking to get more of that metrics, to capture more of that longitudinal patient care data, hypertension, to capture those blood pressures, use that e-care plan technology to capture that, to aid in reporting. Diabetes is coming up, so capturing hemoglobin A1C, and we're looking to do more of that and measure that and hold the teams accountable, because ultimately if you're measured on it, it'll get done. If you don't document and you don't do, it didn't happen. So we want to make sure we capture as much of that as we can, continue to socialize the program, and make sure people know that the materials are publicly available. It's not just for a select few. It's really materials for all to help us scale the program, which is scaling practice transformation in community pharmacy.
Yeah, absolutely. Thank you so much for taking the time to speak with me today, Anne-Marie. Now let's hear from other MGH Life Sciences brands on their latest headlines.